Take all measurements on the right side of the client's body with the subject standing upright. The client's skin should be dry and lotion-free. Do not take Skinfold measurements immediately after exercise. Identify and mark all sites before measuring. To mark the triceps, it must be on the posterior midline of the upper arm, halfway between the acromion and olecranon process, with the arm held freely to the side of the body. You will mark the subscapular 1 to 2 centimeters below the inferior angle of the scapula. The mid-axillary line at the level of the xiphoid process of the sternum will be the next marking. The suprailiac marking will be in line with the natural angle of the iliac crest. 2 centimeters to the right side of the umbilicus will be the abdominal site marking. For my client, who is a woman, the chest marking will be 1/3 of the distance between the anterior axillary line and the nipple. For men, it would be 1/2 the distance between the anterior axillary line and the nipple. You will mark the anterior midline of the thigh, midway between the proximal border of the patella and the inguinal crease known as the hip. Caliper should be placed directly on the skin surface, 1 centimeter away from the thumb and finger, perpendicular to the skin fold, and halfway between the crest and the base of the fold. Pins should be maintained while reading the caliper while holding the caliper in your right hand. Wait 1 to 2 seconds, not any longer, before reading caliper measurements. Take duplicate measurements at each site and retest if duplicate measurements are not within 1 to 2 millimeters. Rotate through measurement sites and allow time for skin to regain to normal texture and thickness. Firmly grasp the skin fold, which is 2 layers of skin and subcutaneous fat between the thumb and the index finger of your left hand, 1 centimeter above the site to be measured. For the triceps, it will be a vertical fold on the posterior midline of the upper arm, halfway between the acromion and olecranon process. When measuring the subscapular on women, it is important to move the client's sports bra in order to attain an accurate measurement. The subscapular will be a diagonal fold at a 45-degree angle, 1 to 2 centimeters below the inferior angle of the scapula. While pinching 1 centimeter above the site, the mid-axillary measurement will be a vertical fold on the mid-axillary line at the level of the xiphoid process of the sternum. There is an alternate method, which is a horizontal fold taken at the level of the xiphoid sternal border in the mid-axillary line. For women, the chest measurement will be 1/3 of the distance between the anterior axillary line and the nipple. It is important to remember when taking men's measurements, the diagonal folds will be 1/2 the distance between the anterior axillary line and the nipple. You will perform a diagonal fold in the line with the natural angle of the iliac crest taken in the anterior axillary line immediately superior to the iliac crest, while pinching 1 centimeter above the marking. While pinching 1 centimeter above the marking, you will measure a vertical fold 2 centimeters to the right side of the umbilicus. The thigh measurement will be a vertical fold on the anterior midline of the thigh midway between the proximal border of the patella and the inguinal crease, remembering to measure 1 centimeter above the marking.